Eye tumors. Introduction. Eye tumors are abnormal growths that can occur in or around the eye, ranging from benign lesions to malignant cancers. These tumors may affect structures such as the eyelids, conjunctiva, cornea, retina, or orbit, and their impact varies from cosmetic concerns to vision loss or life-threatening complications. Eye tumors can be primary, originating in the eye, or secondary, metastatic from other sites. Early detection and treatment are crucial, as malignant forms like retinoblastoma or ocular melanoma can metastasize, while benign tumors may still impair ocular function. Definitions. Eye tumors are neoplastic growths affecting ocular or periocular tissues, which may be benign or malignant, potentially impacting vision or systemic health. A diverse group of ocular neoplasms, ranging from harmless lesions to aggressive cancers, requiring specialized diagnosis and management to preserve sight and life. Risk factors. Genetic factors. Inherited mutations, example RB1 gene in retinoblastoma. Family history of ocular or systemic cancers. Genetic syndromes, example neurofibromatosis, von Hippel-Lindau disease. Environmental factors. Chronic ultraviolet, UV, light exposure, linked to conjunctival and eyelid tumors. Radiation exposure, example prior cancer treatments. Chemical carcinogens, example occupational hazards. Biological and lifestyle factors. Age, example retinoblastoma in children, melanoma in adults. Fair skin and light-colored eyes, higher risk for ocular melanoma. Immunosuppression, example HIV, organ transplant patients. Smoking or alcohol use, potential links to secondary tumors. Etiological classification. Eye tumors are classified based on their origin. Primary tumors arise from ocular tissues, example retinoblastoma, uveal melanoma. Secondary tumors, metastases from distant cancers, example breast, lung. Types. Retinoblastoma, malignant retinal tumor, primarily in children. Uveal melanoma, most common primary intraocular cancer in adults, affecting the choroid, iris, or ciliary body. Conjunctival squamous cell carcinoma, malignant tumor of the conjunctiva, often UV-related. Basal cell carcinoma, common eyelid malignancy, linked to sun exposure. Orbital lymphoma, cancer of lymphoid tissue in the orbit. Choroidal hemangioma, benign vascular tumor of the choroid. Pathophysiology. Genetic or environmental trigger. Mutations or UV damage initiate abnormal cell growth. Down arrow. Tumor formation. Uncontrolled proliferation of ocular or periocular cells. Down arrow. Tissue invasion or compression. Tumor disrupts normal anatomy, example retina, optic nerve. Down arrow. Inflammation or vascular changes. Leads to edema, hemorrhage, or neovascularization. Down arrow. Functional impairment. Vision loss, pain, or cosmetic deformity. Down arrow. Potential metastasis, if malignant. Spread to liver, lungs, or brain in cancers like melanoma. Clinical manifestations. Visible growth or mass on the eye or eyelid. Redness or irritation of the affected area. Blurred or double vision. Partial or complete vision loss. Eye pain or pressure sensation. Proptoses, bulging eye, in orbital tumors. White pupil reflex, leukocoria, in retinoblastoma. Floaters or flashes, retinal involvement. Changes in eye color, iris melanoma. Diagnostic evaluation. History taking. Onset and progression of symptoms. Family history of cancer or genetic syndromes. Exposure to UV light or radiation. Physical examination. Slit lamp examination for anterior segment tumors, example conjunctiva, iris. Fundoscopy to assess retinal or choroidal lesions. Visual acuity and field testing for functional impact. Laboratory and imaging tests. Biopsy or fine needle aspiration, for definitive diagnosis. Ultrasound, B-scan, to measure tumor size and depth. MRI or CT scan for orbital or metastatic evaluation. Genetic testing, example RB1 mutation in retinoblastoma. Medical management. Pharmacological management. Chemotherapy, systemic, example vincristine, for retinoblastoma or lymphoma. Topical chemotherapy, mitomycin C for conjunctival tumors. Anti-VEGF, vascular endothelial growth factor, injections, for secondary neovascularization, example bevacizumab. Steroids, to reduce inflammation or edema in select cases. Surgical management. Excision, removal of small, localized tumors, example eyelid basal cell carcinoma. Enucleation, eye removal in advanced malignancy, example large melanoma. Laser therapy, photocoagulation for small retinal tumors. Plaque brachytherapy, radioactive implant for uveal melanoma. Dietary management. Antioxidants, example vitamins C, E to support ocular tissue health. Hydration, to maintain overall eye function. Anti-inflammatory foods, example turmeric, berries to reduce systemic inflammation. Nursing management. Risk for vision loss related to tumor growth or treatment. Interventions. Monitor visual acuity and report significant changes. Educate on treatment goals to preserve vision when possible. Assist with mobility if vision is impaired. Encourage regular follow-ups for tumor surveillance. Teach recognition of worsening symptoms, example sudden blindness. Risk for metastasis related to malignant eye tumors. Interventions. Educate on signs of systemic spread, example fatigue, weight loss. Administer chemotherapy or supportive care as prescribed. Monitor for systemic symptoms and coordinate with oncology. Encourage adherence to imaging schedules, example liver MRI. Provide emotional support for cancer-related anxiety. Impaired comfort related to pain or tumor pressure. Interventions. Administer prescribed analgesics or anti-inflammatory drugs. Suggest cool compresses to reduce swelling or discomfort. Teach relaxation techniques to manage pain perception. Position the patient comfortably to minimize pressure. Monitor pain levels and adjust care as needed. Risk for infection related to surgical intervention or immunosuppression. Interventions. Educate on post-surgical wound care and hygiene. Administer prophylactic antibiotics if prescribed. Monitor for signs of infection, example redness, discharge. Advise against touching or rubbing the eye. Teach hand washing before applying eye medications. Disturbed body image related to visible tumor or enucleation. Interventions. Reassure about prosthetic options post-enucleation. Discuss cosmetic outcomes of surgery or treatment. Offer emotional support for changes in appearance. Encourage peer support groups for cancer patients. Refer to counseling if self-esteem is significantly impacted. Prevention. UV protection, wear sunglasses and hats to reduce exposure. Genetic screening, test at-risk families, example retinoblastoma history. Eye safety, use protective gear in hazardous environments. Regular checkups, screen for early tumors in high-risk groups. Healthy lifestyle, avoid smoking and maintain immune health. Prompt care, treat ocular injuries or infections quickly. Complications. Permanent vision loss. Metastasis, example liver in uveal melanoma. Orbital deformity or proptosis. Secondary glaucoma, from tumor pressure. Retinal detachment, choroidal tumors. Chronic pain or disfigurement. Conclusion. Eye tumors encompass a wide spectrum of conditions, from benign growths to aggressive malignancies, each requiring tailored diagnostic and therapeutic approaches. While benign tumors may primarily affect aesthetics or comfort, malignant forms pose significant risks to vision and life. Advances in surgery, radiation, and chemotherapy offer hope, but prevention through UV protection and early detection remains key. Comprehensive care, including nursing support, is vital to address both physical and emotional challenges faced by affected individuals.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.